Hi, my name is Jessica. I am from the United States and I am a pharmacy professor, and I am here to find opportunities for my students to make an impact on the world through different health missions. I think the biggest thing for me that I have found that I enjoy about MedLife compared to other places is I love the sustainability of these trips. Instead of just coming in and leaving patients to their own devices if they get some sort of chronic diagnosis or bad diagnosis and just kind of leaving, I appreciate that MedLife has the connections with the community to follow up and make sure that those patients get the care that they need, and really listening to communities and what the communities need. So I think this experience teaches people to kind of work outside their comfort zone and to also be calm and comfortable in your comfort zone. In healthcare, you're going to experience a lot of situations that push you to your limits. You're going to have a lot going on. You may not have all the resources that you need, which is very similar to the situations that you're going to have here. So I think it teaches you to use that critical thinking while also remaining calm in those tough situations. I think for a pharmacy especially, you're gonna have a lot going on at one time. You're gonna be juggling a million different things, and I think it just helps you to remain calm. But also, I think it also teaches you to be a world citizen and realize that the world is bigger than the little bubble that you live in, and that your problems may seem large today, but there's always going to be tomorrow. There's always going to be something else that goes on, and there's probably someone who has a worse problem than you have during that day. So I think it just kind of puts a lot of things in perspective for your life. So in the States, it was just interesting because a lot of patients, especially older patients, will be on multiple medications as far as chronic disease medications. Here the big focus is on acute medicine and what's going on with the patients then and now. I can't tell you how many patients in the States have high blood pressure medicine, cholesterol medication, BPH medications. They're on 20 plus medications, and the elderly here are just trying to get by for their day-to-day health. So things like pain medications because they have to walk up and down all the hills, or an infection that they have going on. So the meds that were used here, while similar, sound very similar to American medications for sure, were just different. We used more acute illness medications than chronic medications. I live with life with no regrets, as cheesy as that sounds. And I think when you go on these experiences, as cheesy again as it sounds, they really are life-changing. You'll make connections with people that you never thought you'd be able to meet. It definitely changes your perspective of the world that you live in, when you never would have been able to get that perspective just from a book or even watching a YouTube video. There's no way to replicate what you learn, or especially what you feel on these trips. I could send you a picture on my Instagram or my TikTok of my experiences, but it's not going to be anything compared to the feeling of actually going on those trips.